Welcome to the 21st Century Man podcast. We're diving deep today into a really crucial aspect of our health. We're exploring chapter 24 of the book, The 21st Century Man,
That's right.
and it's all about keeping your vision sharp.
Yeah, it's such a vital topic. And the author, Dr. Ahad Mahuchi, he brings, well, an incredible amount of experience. He's been a practicing eye surgeon for over 25 years.
Wow.
And what's really compelling right from the get-go is his argument that, so much of the vision loss we see in the U.S. isn't just inevitable, it's actually preventable.
Absolutely. And he makes the strong case that around age 35, that's like a really pivotal time to start thinking proactively about your eyes, getting ahead of things. This chapter, it's just packed with practical stuff, often surprisingly simple, affordable things we can do.
Exactly. It's not about super complex medical treatments in this section. It's more about understanding those, everyday choices and habits, the ones that can have a huge impact. Dr. Mahushi really focuses on what we should be doing, and maybe even more importantly, what we should try to avoid. And it's all backed by solid research that, well, sometimes doesn't quite get the spotlight in healthcare's focus on just treating illness.
So the mission for this deep dive into chapter 24 is pretty clear. We want to equip you with that essential knowledge, those key insights.
Yeah.
So you can take meaningful steps, keep your vision clear and strong for years to come. Okay, let's get into it. Dr. Mahuchi starts by giving us a foundation, understanding the eye. He uses a great analogy.
Oh, yeah, the video camera one.
Yeah.
It's such a helpful way to picture it. He explains we basically have two lenses. There's the cornea, that clear outer part, which has a fixed focusing power.
Okay.
And then inside, you've got the natural lens, which is more flexible to adjust its shape to fine-tune focus.
Right. And then the iris, the colored part, that acts like the aperture on a camera.
Controlling the light coming through the pupil, that black dot in the middle.
Exactly.
And behind all that, you find the retina. Think of it like the film, or maybe the sensor chip in a digital camera now.
Good point.
It's this thin layer of light-sensitive tissue right at the back. And what's fascinating is it doesn't just record light passively. It actually converts light into electrical signals.
Which then travel along the optic nerve to the brain. Now, he points out, within the retina, we've got two main types of light-sensitive cells, rods and cones.
Yep. The rods, they're mostly for low-light vision. They don't do much with color, and the detail isn't super sharp.
Okay.
But the cones, they need brighter light that will give us our color vision and all that fine detail. So rods for a dim room, cones for, say, a sunny day outside.
And the fovea, this tiny central spot on the retina, is just jammed, packed with cones.
Totally.
That's where our sharpest, most focused vision comes from, like when you're reading or looking right at something.
Such a small area, but it has this huge impact on daily life. And then finally, the optic nerve. That's the main cable, basically. Carrying all that visual info is electrical impulses from the retina straight to the brain's processing centers.
What really jumped out at me was just how much brain power is dedicated to vision. He says something like 30% of the cerebral cortex.
It's huge, isn't it?
Yeah. Compared to other senses, that's massive. It really underscores how vital sight is and maybe how much we take it for granted sometimes.
Absolutely. Which brings us nicely to the core of the chapter, preventing vision problems. Dr. Mahuchi, he emphasizes that vision loss isn't, black and white. It's a spectrum.
That's right. We often think blindness, but he points out issues usually start way subtler. He explains acuity well, like 20/50 vision means you see clearly at 20 feet what someone with normal vision sees at 50 feet.
Right. And while legal blindness, which is defined as 2200, or worse than the better eye even with glasses, that's obviously a major disability.
Sure.
But it's important to remember that even, let's say, seemingly minor vision issues can really affect your quality of life. Reading, driving.
Totally. So with that in mind, Dr. Mahuchi dives into the major preventable causes. First up, diabetic retinopathy.
And he's very direct here, calls it the leading cause of visual disability in the Western world. And crucially, stresses it's largely preventable.
That's a powerful message.
It really is.
He explains how high blood sugar from diabetes damages those tiny, delicate blood vessels in the back of the eye. They start to leak, even bleed, and that causes vision loss. The key, he hammers home, is good long-term blood sugar control if you have diabetes.
Yeah, and while there are treatments, laser surgery, injections, Dr. Mahuchi's stance is crystal clear. Preventing it in the first place through managing diabetes is just miles better for your long-term sight.
And he raises a concern, which I thought was interesting, that in the U.S., while we're quick to prescribe meds for prediabetes or type 2, there maybe needs to be a much stronger push for giving people the tools and support for better nutrition, losing weight, getting regular exercise.
Those foundational lifestyle things.
Exactly. The things that can really make a difference in stopping the disease progressing and avoiding complications like retinopathy.
So true. Next up, the chapter tackles cataracts, which are, well, incredibly common as we get older.
Yeah, he says almost everyone gets them if they live past 55 or so.
It's almost universal.
It's basically a clouding of that natural lens inside your eye. He explains when we're young, the lens is clear and flexible.
Right.
But as we age, just natural body chemistry changes make the lens less flexible.
That's presbyopia, right? Harder to focus up close, hitting people in their 40s, 50s.
That's the one. And then later, those same aging processes can make the lens less clear, less transparent, like looking through a smudged window.
Yeah.
Fortunately, cataract surgery is, I think, the most common surgery in the U.S., and it's got a really high success rate.
That's good news.
Yeah, and often a good surgeon can put in a new lens that seriously reduces, maybe even gets rid of, your need for glasses afterwards. He also mentions clear lens exchange as another option for some folks, again, to cut down dependence on glasses. But he adds a smart caution if you have underlying issues with the macula.
That central retina part we talked about.
Right. Then the vision boost from cataract surgery might be limited.
And here's where he brings in a really interesting perspective, drawing on his medical and biochemistry background.
Okay.
He suggests that maybe presbyopia, the lens losing flexibility, and cataracts, the lens losing clarity, aren't totally separate things. Maybe they're part of a continuum.
Huh.
And he even proposes that taking a lutein supplement, which we'll get to later, might potentially help the lens both ways, keeping it flexible and clear. It's a fascinating idea.
It really is. Challenges the standard view.
Okay.
Moving on. Age-related macular degeneration, or AMD.
Right. This affects the macula, that critical central zone of the retina, the bit responsible for our sharpest vision, detail, reading color.
So AMD leads to loss of that central vision. He explains there's dry AMD, where it just sort of deteriorates, and wet AMD, which involves leaky blood vessels growing where they shouldn't.
And this is a big one. Dr. Mauche points out AMD is the most common reason older adults in Western countries lose vision.
Wow.
And what's kind of scary is that the changes in the eye related to AMD can actually start happening years, maybe even decades, before you notice any real trouble.
Yeah, he gives that example. You might still read 20/20 on the eye chart.
Right.
But you find reading takes longer. What used to be quick now drags on. Maybe you need bigger print.
Exactly. And he stresses glasses won't fix that, because his analogy is great here. It's like having cheap film and an expensive camera. Doesn't matter how good the lens your glass is, if the film, the retina, is breaking down, the picture quality suffers.
Makes sense. Next, glaucoma. That's a disease of the optic nerve.
Yeah, and with glaucoma, early detection is just absolutely critical. He really stresses this because any vision loss from glaucoma, you can't get it back.
Oof, makes those regular eye exams seem even more important.
Definitely. He also takes a quick detour to debunk a common myth. States very clearly there's no legitimate medical reason to use marijuana for glaucoma.
Okay.
Explains the dose needed would be impractical, have major side effects. It's just not a viable treatment compared to proper medical options.
Got it.
But what I found really insightful was the link he draws between sleep apnea and glaucoma, particularly for people who actually have normal eye pressure readings.
Oh, how does that work?
He suggests that unrecognized or untreated sleep apnea can actually damage the optic nerve in a way that looks a lot like glaucoma.
Huh.
Which is yet another reason why keeping a healthy weight, managing lifestyle factors to reduce sleep apnea risk is so important for, well, everything, including your eyes.
Wow, that connection wasn't obvious. Okay, finally, in this section on major preventable causes, eye injuries.
And the numbers here are pretty stark. Millions of eye injuries every year. And the vast majority, like 90%, he says.
Preventable.
Totally preventable,
Yeah.
just by wearing the right protective eyewear.
He points out common risks around the house we might not think about. Bottle rockets, racquetball.
Even using a weed eater.
Yeah. And that story about the 11-year-old bystander hit by a firework really drives home that it's not just the person doing the activity who's at risk.
He makes a good comparison to workplaces, too. After OSHA and similar groups mandated safety glasses in industry, workplace eye injuries dropped significantly.
Yeah.
But at home, we get much more casual about it.
True. His actionable advice here is great. Keep a decent, maybe even stylish pair of safety glasses in your workshop or garage.
And one in the car.
And one in the car's glove box. Make it a habit. Put
Yeah.
them on for anything that could send stuff flying, even small jobs.
Simple but effective.
Yeah.
Okay, so moving beyond those, let's call them more well-known causes, Dr. Mauche also flags some unexpected risks, starting with smoking.
And he doesn't mince words. He calls smoking's impact on the eyes disastrous.
Yeah, that's strong language.
And points out risk of vision impairment stays elevated for a long time, up to 15 years after quitting.
Wow, 15 years. And the stats he gives are just deeply concerning. Smoking increases your risk of getting macular degeneration by 400%.
400%.
And if you already have AMD, smoking quadruples your risk of going blind from it.
That's terrifying. He also notes smoking speeds up cataracts. Smokers need surgery about 10 years earlier than non-smokers typically.
And they're more likely to have complications after the surgery, too. It just adds insult to injury.
Yeah.
Plus, he links smoking to other serious eye problems like vein and artery occlusions blockages. His conclusion is blunt. From an eye health perspective, it makes absolutely no sense to smoke.
Can't argue with that. Okay, another maybe more surprising risk he brings up involves certain medications for erectile dysfunction. Things like Viagra, Levitra, Cialis.
Right. And while he acknowledges they work well for many men, he raises a serious flag about potential visual side effects, including, although it's rare, permanent blindness.
Blindness from those.
Yeah, it's a condition called anterior ischemic optic neuropathy, or AION. Basically a sudden cutoff of blood flow to the optic nerve.
Okay, how do the drugs cause that?
He explains these drugs can lower blood pressure within the eye, which normally isn't a problem, but if the blood supply to your optic nerve is already a bit dodgy, that drop in pressure can be enough to cause damage. His advice is really sensible. If you use these meds, definitely don't smoke.
Right.
And, crucially, talk openly with your ophthalmologist about using them. He suggests asking your doctor specifically if you have what's called a disc at risk.
Oh, a disc at risk.
Yeah, it's a particular anatomical look to the optic nerve head that makes someone more susceptible to AION. Worth asking about.
Good practical advice. Okay, shifting gears to something more positive. Prevention through nutrition. The chapter looks at supplements, starting with lutein.
Yes, lutein. He explains it's a natural compound related to vitamin A found in dark green leafy vegetables, think spinach, kale.
Okay.
And it plays a crucial role in how the macula functions. He cites research showing good lutein intake can cut your risk of age-related macular degeneration by about 30%.
30% is significant.
It really is. And he points out the irony, right? Western diets often lack these lutein-rich greens.
And Western populations have higher rates of AMD.
Exactly. Now, while eating lots of greens is obviously great for overall health, Dr. Mauche acknowledges it can be tough to consistently eat enough to get the therapeutic levels of lutein for eye protection.
How much are we talking?
He mentions needing probably around 5 servings a week of things like spinach, kale, collards. Plus, he notes some evidence suggests our stomachs might actually break down a fair bit of the lutein we eat anyway.
So it's hard to get enough just from food.
It can be. So because of that, he recommends just taking readily available, pretty inexpensive 20 milligram lutein capsules. It's a reliable way to ensure you're getting that protective dose.
Makes sense. He quickly mentions vitamin A, too.
Right, just noting that while vitamin A deficiency is a huge issue in developing countries, it's generally not a worry for most people listening to this. It's fat-soluble. We usually get enough fat in our diets to absorb it.
Okay. Then he moves to omega-3 fatty acids.
And here he's pretty firm. He says while the debate about omega-3s and heart health is kind of still ongoing,
right,
for eye health, the science is pretty much settled. Omega-3s, he states, have been shown to reduce the risk of age-related macular degeneration by a really impressive 40%.
Wow, 40%.
Yeah. So he emphasizes if you combine taking lutein and omega-3 supplements, you could potentially achieve a really substantial drop in your risk of developing AMD.
That's huge, considering AMD is a leading cause of severe permanent vision loss for people over 60.
Absolutely.
Yeah.
Powerful combination.
So finally, the chapter moves into solutions for visual impairment, going beyond just prevention. He acknowledges, our modern digital lives.
All that screen time.
Yeah, especially looking at computers at that intermediate distance.
He points out that the old school solutions like bifocals or trifocals can sometimes cause neck strain when you're trying to focus on a screen. You have to tilt your head funny to find the sweet spot. And he emphasizes there is no single perfect answer here. The best approach really depends on you, your job, your lifestyle, how much time you spend on computers versus outdoors.
One option he discusses is monovision.
Right, where one eye is corrected for distance and the other eye for near vision. You can do it with a surgery or contact lenses.
Sounds clever, but are there downsides?
Yeah, he flags a few potential issues, like your near vision needs can change over time, so the correction might not always be right. And getting the dominant eye tested accurately is really important. Plus, trying it with contacts can be irritating, especially if you tend to have dry eyes.
Okay. What about multifocal contacts or lens replacements?
Those work by splitting the light entering the eye, trying to give focus at different distances simultaneously.
Does that work well?
The TEP's getting better, but he notes it can sometimes mean images seem a bit dimmer or less sharp compared to just single vision correction. He definitely recommends trying multifocal contacts before you'd ever consider a surgical lens replacement.
Good tip.
And he mentions night vision can be an issue for some people with these.
Okay. Any other surgical approaches?
Yeah, he talks about accommodating lens implants, like the crystallines. These are designed differently. They try to flex or shift focus, aiming for clear vision at distance, intermediate, and near, but without splitting the light.
Oh, that sounds better.
Generally, he says they don't cause major night vision problems. They tend to give excellent distance and intermediate vision. Near vision is usually decent, maybe around 20/40.
So who are they good for?
He sees them as a solid option for people who are farsighted and over 55, but there can be limitations for younger folks or those who are nearsighted.
Gotcha. And then there's laser vision correction, like LASIK.
Hugely successful for correcting distance vision, he notes, but he's clear. If you're over, say, 45, it won't magically give you perfect distance and near vision. You'll likely still need reading glasses for up close.
Right. Presbyopia still happens. You give some really crucial advice if you're thinking about laser surgery.
Yeah, definitely. Be super wary of bargain basement pricing. Make absolutely sure you meet the actual surgeon who will do the procedure beforehand.
Don't pay before the screening exam.
Exactly. And be cautious if the staff seems more focused on sales than on your medical suitability.
He also mentions the dry eye risk after surgery.
Suggests using lubricating drops like Theratears Extra beforehand, maybe? And choose a surgeon who actually acknowledges that risk openly.
Good point. And be aware of potential financial incentives behind referrals. Do your own research.
Always good advice.
Lastly, he briefly touches on sunglasses, UV protection, and polarization.
Right. He says while UV protection offers some long-term benefit against cataracts, its impact is way smaller compared to things like not smoking or eating well. Focus on the big stuff first.
Makes sense.
But polarized sunglasses, he recommends those, especially for bright sun and glare. Prescription versions are widely available, and he notes the ones from your eye doctor are usually better quality, clearer, more scratch-resistant than cheap ones. He even gives a simple test to check if they're really polarized.
Useful stuff. Wow, that was a really comprehensive look. Not just treating problems, but really understanding the causes and, crucially, what we can actually do to prevent a lot of this.
He really has put together a fantastic resource in this chapter. It covers so much ground.
Absolutely. So this deep dive into Chapter 24 of The 21st Century Man, hopefully it's giving you some incredibly valuable insights and, even more importantly, some actionable steps.
Yeah.
Things you can start thinking about, maybe implementing today to keep your vision sharp and healthy for, well, for the long haul.
And we really do encourage you to read the whole book, The 21st Century Man. Dr. Mauche and the other experts who contributed, they've gathered just a wealth of vital information, covers all sorts of aspects of men's health today.
And it's presented really well, isn't it? Easy to understand, genuinely engaging.
Totally accessible.
Remember, taking those proactive steps for your eye health now, it can make such a profound difference to your quality of life down the road. Thank you so much for joining us for this important deep dive.
Yes, thank you. And please do join us next time on the 21st Century Man podcast. We'll be delving into another critical area of well-being in our deep dive into Chapter 25, preventing hearing loss. We look forward to having you with us then.